Hairblazer, today we are going to talk about something that almost nobody talks about openly, but inside our support rooms and inside private conversations I've had with many dementia caregivers, this is something many of you are dealing with, and it has to do with why so many people with dementia have trouble using the bathroom. I'm talking things like they will stop wanting to sit down on the toilet to have a bowel movement. They might pee in a pot container in the living room rather than going to the restroom. They may seem to not know what to do in a bathroom at all. You maybe have tried the motion lights, the bringing them to the bathroom, trying to do everything you can to get them to be able to use the bathroom, and nothing seems to be working. We're going to talk about all of those common but rarely talked about situations in today's video. The most important thing, and I want to say this clearly, is that most bathroom confusion when it comes to dementia is not defiance or stubbornness or laziness. It's actually a neurological issue. The bathroom is one of the most cognitively demanding spaces in the home because it requires body awareness, multi-step sequencing, judgment, motor planning, visual spatial processing, timing, social rules, sensory interpretation. So many things our brain is doing when we enter a spot like the bathroom. And it's requiring a lot of our brain systems to work together. But dementia has disrupted those brain systems. So one common reason for bathroom difficulty, especially if the person with dementia doesn't seem to be aware they have to go. You may ask them, do you have to go to the restroom? Do you have to urinate? And they say no. And then 10 minutes later, they've urinated on themselves. This has to do with something called interoception. And interoception is the brain's ability to sense internal body signals. So the signal that we get, oh, I need to go pee, they're not getting that signal. They are not getting the signal that their bladder is full, that there's rectal pressure, whether it's going to be gas or stool, whether they've actually completely emptied themselves. Those things our brain is doing for us, it's not necessarily doing it for the person with dementia, especially in moderate to advanced stage dementia. The brain is not accurately or consistently registering those signals anymore. That means they genuinely may not know if they have to use the restroom, if they're done using the restroom, or what the sensation in their body even means. So if they are having some sort of sensation, their brain isn't registering what that means. It's not confusion on purpose. It's a disruption of the signal processing. Now, another common cause for a lot of bathroom confusion is something called apraxia, which there's different types of apraxia, but what it comes down to is with difficulty planning and sequencing movements. When we use the bathroom, it is not just one action. It's you enter, you turn, you pull down pants, you turn around, you sit down, you relax your body, you wipe, you flush, you pull up clothing, you walk out of the bathroom. So if motor planning is impaired, they might just stand there and ask, what do I do? Or just stand there and look confused. In fact, many people with dementia go on to develop apraxia, and I recorded a separate video all about apraxia about a year ago, and I'll make sure to link to that in the description below. So if you notice your loved one is having problems doing certain simple movements, even though you know they have the ability to do that movement, they just don't seem to do it when you need them to do it. This is a sign apraxia might be happening. In addition to apraxia, another common symptom many people with dementia experience is aphasia. And aphasia can impact the way a person understands words and the way they're able to express words. So if they have the type of aphasia that makes it difficult for them to understand your words, even if you are standing there with them and you are saying, sit down, turn around, pull down your pants, they genuinely might not be able to fully understand what you are saying. All right. Now, why does confusion sometimes seem to get worse in a bathroom? Well, just think about the way most bathrooms look. For the most part, they look way different than every other part of the home that they're used to spending time in. It's usually bright lights, lots of white, very little contrast. Everything seems to blend in together. There are mirrors, there's echoes. It can even be colder than the rest of the house. So for somebody who has visual perceptual changes, depth perception and contrast may be out of whack. The toilet seat might not register visually as a toilet seat. They might not understand where and how to position their body. So sometimes simply entering the bathroom tends to increase confusion. Not so much because they've necessarily forgotten what to do, but because the environment exceeds their processing capacity. Okay, now there is something medically important to be aware of because it is incredibly common with older adults and older adults with dementia specifically. If you are noticing that your loved one's stool seems incomplete, there's like frequent small amounts throughout the day. There might even appear to be like smearing in the underwear or even along the gluteal crease. Maybe the stool that's coming out seems loose or watery, as if it keeps leaking out, especially if it seems like it could almost be diarrhea, but it's in small amounts. These could all be signs of fecal impaction. What that means is that there is a large, hard piece of stool that becomes stuck inside of them and cannot pass through. And so liquid stool from higher up in the intestine starts to leak around that hard stool, and it comes out as loose or messy bowel movements, but it can look like diarrhea. It's actually severe constipation with a blockage underneath. It's very common in dementia, very misunderstood. It absolutely warrants medical evaluation. I say this because not all bathroom problems are always just dementia. Sudden changes should be evaluated because there can be other medical underlying conditions that are creating some of the bathroom troubles that you are dealing with. Okay, this is an interesting symptom that happens a lot around bathrooms. The person with dementia doesn't want to sit on the toilet. Maybe they're totally okay standing and urinating, but when it comes to sit down on the toilet, they just do not want to. This can be due to a couple of reasons. Number one, fear of falling. Number two, poor depth perception. Number three, rigidity, especially in frontal temporal dementia, where they're just like super rigid and don't seem to want to move. Sensory discomfort, misinterpretation of the toilet and what they're supposed to do there, sometimes even pain sitting down. So sometimes, again, it's not refusal, it's literally uncertainty and fear that can be manifesting as them just not wanting to sit on the toilet. Now, this video is getting to be pretty long, talking about a lot of common causes of bathroom challenges that don't get talked about openly. We're not going to be able to solve everything today in this video, but here are some principles to keep in mind. One, simplify the environment, reduce clutter, improve contrast. So if everything looks white, maybe put a toilet seat cover on the toilet to bring attention there and to make it look separate from everything else. Make sure there's decent lighting. Number two, if you're giving them instructions, cue one step at a time. You don't want to give the full explanation or all of the steps, or even just saying, go to the bathroom or use the toilet. There's all these little steps in between. Just cue one tiny step at a time. See if that does anything to help improve the situation. Whenever possible, number three, use physical demonstration over verbal demonstration. This might mean that you walk over to the toilet with them. It might mean that you motion to pull down their pants. Also, alongside of that, sometimes what I've noticed is that when these bathroom situations start to happen, it's typically a sign that they need more hands-on help. So now we might be entering the stage of dementia care where you're actually providing them hands-on help. So we move from verbally telling to demonstrating to actually doing for them. So finding out where they might be along those lines is something that we have to evaluate. Number four, schedule bathroom visits. So if they're losing their signal and their awareness of what their body needs, we cannot rely on them and rely on their awareness of when they have to go to the restroom, we might need to do what I call sometimes putting them on a bathroom schedule and just saying, oh, hey, it's time for a bathroom break, and encouraging them to go rather than waiting for when they think they need to go. And then lastly, making sure we don't attribute everything to dementia. If you are noticing changes in their stool pattern, sudden incontinence, straining, pain, blood, major behavior shift, we always want to get that further evaluated because some of it's dementia and some of it's an entirely other medical condition or situation, and it's okay to check with their doctor. Now, any video talking about bathroom challenges would be incomplete if we did not take a moment to just acknowledge the emotional toll a lot of this takes. Bathroom challenges are one of the hardest parts of dementia caregiving because it's not just the physical aspect of helping somebody with the bathroom. There's dignity, embarrassment, exhaustion, there's smell, there's shame. All of these things are natural human reactions for the person with dementia and for us. And I want you to know that you're not alone. It's common. It doesn't mean you failed. It doesn't mean you're horrible. It doesn't mean something's wrong with you. It means this is a very sensitive subject. It's something that we have been dealing with ourselves in private for the majority of our adult lives. So when it comes to trying to help somebody with something so private, there's lots of emotions that happen. And if it's to us, if we're the person who needs to start accepting that help, of course, we're going to have some difficulty with that. So the brain is changing. And sometimes it happens in ways that create lots of uncomfortable situations. So in closing, I want you to know that sometimes people with dementia, they don't know when they have to go. They get confused, more confused than normal inside of a bathroom environment. They might have difficulty sitting down. They might have stool changes. They might start voiding even while you're in the cleanup phase of trying to clean them up. It's because in dementia, it impacts so many bodily systems from motor planning, body awareness, executive function, environmental processing. All of that is, of course, going to impact daily functioning, including something that we do multiple times a day, which is use the restroom. I know this won't answer all questions or even provide solutions to every problem, but I certainly hope it helps shed some clarity and light into a really common, challenging situation. You're doing hard work, Careblazer. You're doing amazing work. I will be back next week with another video. If you haven't already signed up for our weekly newsletter called the Dementia Dose, I personally send out one email a week where I share a thought, something I'm observing, a tip, a practical strategy that you can apply in your caregiving life. All right. Sending you love. Bye.
Also, Nico gets a belly rub for every person who subscribes from this video. So if you haven't already, click the red subscribe button. It's totally free. And Nico says, thank you very much.